Hi, good afternoon, everyone. I'm Dr. Tanvi Bhatt. I am a consultant chest physician. Tuberculosis is the oldest infectious disease worldwide due to a single pathogen, which is Mycobacterial tuberculosis. It is also called as COX. So, it is caused by the particular bacteria that is Mycobacterial tuberculosis. How does it differ from other viruses or bacteria? Whenever you get infection with any virus or bacteria, it infects your immune system. You either develop the infection, get symptoms, take antibiotics, and get treated with it, or either you develop immunity against it and you're completely treated with it. What happens differing in this case is when you get infected with Mycobacterium tuberculosis, it goes through inhalation, that is, when you breathe in, it goes through that, it goes inside your lungs, and in a part of the lung is it is staying in a inactive and dormant stage. It does not multiply inside your lung if your immunity is good. It stays in your lungs lifelong. Anytime if your immunity level goes down, it may get deactivated. It will start multiplying. It will form a lesion or a patch in the lung. If not treated, if your immunity still does not develop, it will spread to the entire body. So this is how we have a stage where the patient is infected with TB but still does not have TB, and the stage where the patient develops active tuberculosis. The spread of tuberculosis is through droplet infection. Any patient who is having active tuberculosis, which is in the multiplying stage, in that stage, if the patient does any cough, talk, laughter in an enclosed space or a crowded space, there are chances that the patient will spread it to 5 to 15 people around. Whoever is the next person getting those droplet infection from the patient, again in that patient, the infection will go inside the lungs, stay in a dormant stage. Depending on the immunity condition of the patient, it will either stay in the dormant stage or develop an active infection. Once it has developed in an active infection, it either stays in that area of lung or it gets spread to other parts of the body also if the patient is not having good immunity. Other things how the patient can get is if the patient is in close contact with an active patient, if a person in the house has TB and if there are close contacts staying nearby every day, then again there is a risk of developing tuberculosis. Signs and symptoms of tuberculosis depends which part of the body is developing tuberculosis. Most common developing organ with tuberculosis is the lungs, that is the pulmonary tuberculosis. If the patient is having pulmonary tuberculosis, he may have common symptoms like cough, which is more than 3 weeks, a fatigue, fever, which will be low grade, not of very high intensity, low grade fever, night sweats, that is during the evening time, the fever will rise and the patient will have sweating during the night. There will be reduced appetite, patient will not feel hungry, and there will be an acute loss of weight over a period of 2 to 3 weeks. If the infection is not contained here and if the infection is spread to other organs, then the symptoms depend on which organ it has infected. Other most common organs of tuberculosis are lymph nodes, which can be in the cervical area or in the abdomen, which is abdominal lymph node tuberculosis. All parts of the body can get tuberculosis, starting from skin, eye, bones, brain, kidney, liver, abdomen, genitals, uterus. So these are multiple organs, every organ you name, and that can develop tuberculosis. Depending on the organ, the symptoms do vary. But these are some common symptoms like weight loss, loss of appetite, fatigue, evening rise of fever, and night sweats, which are common in all the patients. Patients of pulmonary tuberculosis can also have yellowish color sputum expectoration, hemoptysis, that is coughing up of blood from the sputum, and progressive breathlessness because of excessive areas of lungs involved. Tuberculosis is common in developing countries and underdeveloped countries. Initially, it was called as poor man's disease, but now it is no longer the same. Anyone whose immunity is at risk can develop tuberculosis. So first we will see that group of patients who has low immunity. First being HIV, second being patients which are immunocompromised, that is patient who has undergone renal transplant or they are on medications which reduces their immunity. That is, patient if any patient is taking steroids or any monoclonal antibodies or disease reduce drugs which reduce the immunity, like drugs used for arthritis, cancer patients, diabetes patients. In diabetes also there is reduction in immunity and there are high risk of chances of developing tuberculosis. Then there are patients, this was patient related. Then there are patients who are in close contact with TB patients. That is relatives or neighbor or household contacts of TB positive patients, and other are healthcare workers. Tuberculosis can be diagnosed based on the symptoms, again, whether the patient has pulmonary tuberculosis or extrapulmonary tuberculosis. If the patient has pulmonary tuberculosis, the main test that we advise is the sputum examination. Remember, there's a difference between saliva and sputum. Saliva is something which is present in the oral cavity, you spit out immediately. Sputum is which something which comes from inside the lungs. So that is a sputum sample which has to be given. Early morning sputum sample has to be given. There are two tests. First is AFB, Zn staining, which is available immediately through seen through the microscope whether the bacteria is there or not. And second is a molecular diagnostic test called as gene expert. It tells whether the TB is present in the patient or not present, and whether it is a drug sensitive TB or drug resistant TB. Other tests, the old tests are, one is skin test, tuberculin skin test, which we do in this area, also called as MANTU test. It tells about the infection, whether the patient is infected with TB, but it does not discriminate whether it is active TB or latent TB. That is the one which does not multiply, which I had told you earlier. And the recent blood test which we have for tuberculosis is IGRA test, which is interferon gamma release assay. It is similar to the skin test which was available. Again, it tells you about the infection and does not tell about whether the patient is having active infection or not. Then, depending on what organ is involved in tuberculosis, we do other tests, radiological tests. If the patient is having pulmonary tuberculosis, that is of lungs, we do chest X-ray, CT scan. If it is of bone or brain, then other scans like MRI, CT, X-ray, depending on what organ it is involving. Sonography is advised for uterus, for abdomen, or for any lymph node. So, if the patient is developing tuberculosis, if the patient is taking proper treatment and completing the treatment, it can be cured completely. You have to monitor the patient every monthly till the treatment completion. And there are certain tests that we advise on the completion of the treatment which needs to be done that declares the case as cured. So till that time, the patient has to be monitored completely. So the treatment are only oral drugs for tuberculosis. They are divided into what type of tuberculosis the patients have. So there are basically two main types. First is drug sensitive tuberculosis and second is drug resistant tuberculosis. There are four main drugs that we give in tuberculosis. So the most common drug, which is rifampicin. If the patient is having bacteria which will respond to this drug, then we called it as drug sensitive tuberculosis. If we have the bacteria which will not respond to this drug, it is called as drug resistant tuberculosis. The test that we did, gene expert, that itself tells us whether the drug is sensitive or not resistant. So, if the patient is having drug sensitive tuberculosis, the treatment starts for a period of 6 months. It can last up to 8 months or 1 year, depending on what organ is involved. If there is involvement of brain or bone, we treat it for 1 year. If it is lungs or any other organ, we treat it for a period of 6 to 8 months. If the patient is having drug resistant tuberculosis, depending on again what type, there are three main types, which is multi drug resistant, then total drug resistant, and extremely drug resistant. So, depending on which type is there, again the treatment will change. But the duration of treatment of multi drug resistant TB is from 9 months to 2 years, and then it consists of six or more drugs. The side effects of these drug profiles are also very high and they have to be monitored very properly. There are chances that because of the side effects, patient might leave the treatment, and that increases the spread of MDR TB to rest of the patients. So, what is the key in treatment of tuberculosis is early diagnosis of the patient before the patient spreads to other people and treat it immediately. If the treatment is for 6 months, even a single day missing of the dose should not be done. And only after completion of the treatment, only after the cure is declared, after that only the patient has to stop taking the medicines. Identifying self symptoms of cough, fatigue, loss of weight, appetite. When you get these symptoms, you have to immediately reach out to the nearby doctor, get yourself investigated by clinical examination, get the advised tests done. So early diagnosis and treatment becomes the mainstay of the treatment. Second is, if you are diagnosed with pulmonary tuberculosis, see to it that you do not spread it to others. You have to isolate yourself inside a room. You have to avoid going to workplace which are crowded for a period of at least the intensive phase, which is 2 months. And if you're coming in contact with people, you have to wear mask. Whenever you're coughing, you have to cover your mouth so that you do not spread it to others. So first is early diagnosis and treatment. Second steps becomes, whenever the patient is diagnosed with pulmonary tuberculosis, all contacts should also be screened if whether they have tuberculosis. So if they are also diagnosed at a very early stage, they can also be treated and their disease will not progress. Third is the diet, which is very important. So, like I explain it to my patients, if you are going to step out of your house without your breakfast and you are going to travel in a crowded bus or a crowded train and meet too many people, that is going to increase your risk of tuberculosis. It is mainly commonly seen in the age group of 15 to 45, which are having more interaction with the common public. So, diet, a high protein diet, is more important for treating as well as preventing tuberculosis. And using masks whenever you have symptoms, or asking people also to use masks whenever they are coughing in public places. Other concept is of treating latent tuberculosis. So, as I told you, 40% of the Indian population is infected with tuberculosis. That is, they have the infection, but they do not have an active infection. So, latent TB can be treated if the patient has to be started on steroids or any drugs which reduce the immunity. So, treatment of latent tuberculosis also can be done as a part of prevention.